This message is from the George Washington Epilepsy Center to our patients with epilepsy. First, we would like to remind you that the George Washington Medical Faculty Associates will continue to see patients via video calls. So please call our center at 202-741-2700 to schedule a televisit. The epilepsies are of many different kinds, but seizures have some universal triggers. These include missing medications, excessive stress, sleep deprivation, and alcohol use. The current situation with the COVID-19 pandemic is extremely stressful and unprecedented in recent history. These are our recommendations for you during this pandemic.
First and foremost, please never miss any doses of your anti-seizure medications. Call our team and have your medications refilled before you run out. If you need to contact your epilepsy doctor at GW Medical Faculty Associates, call our office or send your provider a message via Follow My Health. If you have a fever or need an ER visit or hospital admission for any reason, make sure that your providers know your medication list and the exact doses. If you entertain using any medications or supplements, especially unapproved ones that are thought to be effective in treating the novel coronavirus infection, please consult with your doctor first.
We strongly encourage you to maintain a daily routine with regular sleep schedule. Sleep irregularities and sleep deprivation are known to be seizure triggers. Some people may be inclined to use alcohol during stressful times. We highly discourage this in individuals with epilepsy because alcohol use is known to be a trigger of seizures.
If you are tempted to use unproven medications or supplements or other methods for preventing infection with novel coronavirus, please first consult with your doctor. If you have a fever or are going to be seen in the hospital for other reasons, make sure your providers know your medication list and their dose.
Last but not least, we also highly recommend physical exercise and mindfulness-based meditation and yoga. Indeed, one study that was done prior to the COVID-19 pandemic found that mindfulness meditation could decrease seizure in individuals with epilepsy. You will find a lot of online resources, including videos and application on your phone that will help you do exercise at home and provide guided meditation. Also, maintain connection with others through phone and video calls. Social connections are indispensable for stress reduction.
A lot of you are wondering whether COVID-19 infection is associated with seizure risk. At the George Washington University Hospital, we have taken care of many patients with COVID-19 infection and have not seen an increase in seizures. Consistent with our experience with COVID-19 patients at GW, a recent study from China evaluated the occurrence of seizures in more than 300 people who were admitted with COVID-19 infection, and 1/3 of these people were in severe condition. Seizures were not seen in all of that cohort. So the authors conclude that neither the virus nor other risk factors for seizures that are associated with the COVID-19 infection seem to increase the risk of acute seizures in infected people.
In a previous report about the neurological manifestation of COVID-19 infection that came from Wuhan, China, where the infection had started, only one case of seizures was reported among over 200 patients, and we do not know if that patient had a pre-existing epilepsy or not. Therefore, the available evidence suggests that neither epilepsy increases the risk for this infection, nor does the COVID-19 infection increase the risk of seizures.
However, it is to be remembered that any acute infection that results in fever tends to increase the risk of seizures in individuals with epilepsy. In addition to acute illness and fever, there may be other risk factors associated with increasing the chances of seizures. These include decreased oxygen delivery to the brain because of the infection, increased risk of stroke, and the potential need for some antibiotics that may be needed during hospitalization, some of which can also increase the risk of seizures. If you have seizures related to alterations in the immune system called autoimmune epilepsies, or if you have seizures secondary to cancer, you may be receiving medications that weaken your immune system and put you at a higher risk for infections, including COVID-19.
Therefore, we strongly encourage you to follow the recommendations of the Centers for Disease Control and Prevention, www.cdc.gov, to help avoid COVID-19 infection. In addition to CDC, please follow the recommendations of your local authorities and check the Epilepsy Foundation website, www.epilepsy.com, for further useful information. Stay safe and have a great day.